And we've talked about, starting to reopen, the state's looking to reopen beginning Monday, of course, in phases. What phases is MU Healthcare taking to reopen?
So we're starting to increase our capacity to take care of patients in person. So in the clinics, for example, we are putting safety measures to protect the patients and allow us to see more patients in person who need a physical examination or lab test or x-rays to be done to help guide their care. And in other areas, for example, we're going to start doing scheduled surgeries that have been deferred to allow patients to get the treatment that they need to move on from their medical conditions and improve after surgery, for example.
Okay, I was going to ask about those elective procedures because that's kind of the first thing we saw put on the back burner, per se, as soon as this virus started picking up. So what types of procedures will you start doing first?
So MU Healthcare had something more than 2,000 scheduled surgeries that were deferred, and then we tackled those surgeries that it was not safe to defer for the patient's well-being. So we have quite a bit of backlog of cases that need to be taken care of. And some examples would be someone who has a hernia, which is not causing symptoms that are severe right now, but has a risk of complications if not treated surgically. If we can safely manage that, then repairing that hernia in the near future is desirable for the patient.
Do you see MU Healthcare getting those procedures done quickly, or is it still going to kind of be a slow process where people might have to be put on a wait list?
I like the governor's analogy of this is not a switch. We just can't turn back on this capacity. So it's going to be a dial-up. And that's especially important to preserve the safety of the patients and the providers. And so I think it's going to be a gradual ramp up, and then if we can prove that we're doing that safely, add continuously more capacity, and then there'll be a phase where we'll have to probably work extra hard to catch up so that these patients don't suffer consequences of deferring their scheduled surgeries or other health care.
Okay, Dr. Wakefield, thank you so much. We'll check back in with you coming up in just about 20 minutes. Again, thank you for your time.
Thank you.